This is Listen Lakeland, the show that keeps you up to date on all the things that make our city a great place to live, work, and play. Today's host is a former hospital administrator and currently a healthcare consultant in operations, strategy, and facility planning. She's also served on a number of city and nonprofit agency boards in the Lakeland and Tampa Bay area, including Interact Alliance, and currently is the chair of Lakeland Vision. Please welcome your host, Carole Philipson.
Welcome to the good life.
Thank you so much for joining us today. I'm Carole Philipson, and it's great to be hosting this month's episode of Listen Lakeland. This show is an extension of Lakeland Vision. For over 2 decades, Lakeland Vision has been a voice for the citizens of Lakeland, working with our community stakeholders to create a bright future for our city. I'm very pleased today to have Allie Bates and Liz Craven joining me so we can learn a little more about Age Friendly Lakeland, which happens to be a committee of Lakeland Vision. Liz, you're the chair of Lakeland Vision, and Allie, you serve as the coordinator. For our listeners that may not be familiar, Allie, can you tell us a little bit more about this initiative and how it came about?
Yes. So the AARP Age Friendly States and Communities serves as a catalyst to educate local leaders and encourage them to implement the types of changes that make communities more livable for people of all ages, especially older adults. And there have always been conversations and leadership groups to address seniors' needs in our community. And this is more of a formal structure that Lakeland Vision can use to implement through strategic planning some action and get some results. The network provides us with more age-friendly resources by tapping into national and global research, planning models, and best practices.
Thank you. Liz, now Age Friendly helped the city of Lakeland obtain the Age Friendly Community designation back in 2017. Tell us a little bit about that process and how it helped prepare you all to make positive impacts on our city.
And what a process that was. It was an exciting process. And as Allie said, we've had a lot of leadership structure over the years and a lot of groups that were addressing age-friendly type initiatives and really taking a close look at our community in order to define the gaps and figure out how to fill those gaps together as community stakeholders and leaders. And when we ventured to go the age-friendly route, it gave us access to a lot more than we had access to before, as Allie mentioned. And so what we did as a group, we used to be the Lakeland Leadership Council on Aging. Lots of names changed throughout the years, but formally and informally, this discussion has been happening for more than 25 years. I know I've been around for 29 years, and it's been happening that whole time. So there's a lot that's going on. We've made a lot of progress over the years. But what we did through the age-friendly communities structure is to do a survey, a comprehensive survey of our community about how we were doing as it relates to being an age-friendly community. So we talked to people who were in the age range of 45 plus. We included the younger part of that demographic because those are the folks who were caring for their parents. And so their needs were just as important as the needs of an older adult. Through that initiative, we spent about 8 months surveying our community to find out what we're doing well, what we're not doing well, where the greatest needs were, and to get an idea of how to best approach the gaps that we were experiencing. And through that, we came up with an action plan, which you can find at agefriendlylakeland.com. And we have been steadily working through that plan and adding, and it's an ever-growing type of document. It will never be the same. So always adding and subtracting and checking off the boxes as we make things happen, not alone, but with the community at large. So we're very proud of the work that Age Friendly is doing and very proud of the partnerships and collaboration that are happening across the board.
Thank you, Liz. And Allie, for our listeners, tell us what type of organizations and individuals serve on Age Friendly Lakeland.
So we've got a a real mix of people that serve on our community committee, and they go as far as elected officials, government agencies, nonprofit organizations and foundations, representation from some academic institutions, community coalitions, local businesses, chambers of commerce, the residents, and we have some volunteers also.
Very good. Now, Liz, a large portion of our Lakeland population, and perhaps you can tell us that proportion, falls into the age category considered a senior citizen. Why is it more important than ever to make sure that people are aware of all the resources that our community offers to the older adults?
It is so vitally important. And yes, depending on where you put that age break, if you're looking at 60 plus in our community, there is greater than 25% of our demographic that is represented in that age group. And why is that important? That's a great question. And a lot of people wonder the same thing. Well, at 60, I'm active, I'm doing my thing. Yes, we are. But in a few years, we might be in a situation where we need some assistance. We might be in a situation where we just need access to good information. And that is the purpose of Age Friendly Lakeland, to make our community a place where people have access to the tools they need, the information they need, the help they need to live a long, quality life as independently as possible. And that takes a lot of forms because every person's scenario is different. Your senior years will not look like my senior years and vice versa, because it all depends on a lot of different factors. There are many in our community who do not have family close by. It becomes vital for them to have access to the right information and the right programs that can help them to live successfully. Unfortunately, there are many in our community who are by themselves, who don't have the support of a family, and neighbors may not know that they're in that type of situation. And so it takes a lot of effort from the community at large to know who your neighbors are and to make sure that they have access to the tools and the things that they need to live successfully.
Thank you. And since Age Friendly Lakeland is a committee of Lakeland Vision, tell us how AFL, Age Friendly Lakeland, works in conjunction with the Citizens Visioning organization, Lakeland Vision. How is it similar?
I think that's the most exciting question by far, because if you're not familiar with Lakeland Vision, and if you're listening to this, you probably are, but really take a close look at what Lakeland Vision is doing. Lakeland Vision is about you, and it's about me. It's about what we view as the best scenario for our community and the type of community we want to live in. Well, Age Friendly Lakeland is cut from the same cloth. So what we do through Age Friendly Lakeland, which is a committee of Lakeland Vision, we look for the gaps. We look for the things that community says they want that don't exist, and then we look for the solutions to that. We don't do that by ourselves. Probably the most beautiful part about Age Friendly Lakeland and Lakeland Vision is that when we've identified a gap, we walk into the community and to the leaders and stakeholders and say, hey, this is something the community says that it's looking for. How can we work together to make that happen? We'll approach organizations who may be doing something similar already and ask, how can we help you to expand to be able to cover this as well? Or what are your thoughts and your ideas to make this happen? We are very intentional about not being the doers, but the visioners. We are the conveners of the conversation. So while a lot of organizations are out there doing amazing things, they can't do it all. And it is also very difficult sometimes for an organization to break away to create the conversation that's going to fill the gaps that we're looking to fill. And so if we can do that on behalf of our community and draw those conversations to the table and then lead into action, linking arms with our community partners, then we're in good shape. And that's exactly what we do.
Thank you. And Lakeland Vision serves in that role as well. So they are very similar. We are the conveners, not the doers.
Yes.
Allie, speaking of the Citizens Vision, AFL touches on several goals within the community's vision, including seniors, health, parks and recreation, volunteerism, sense of community, safety, jobs. What are some of the current initiatives that AFL, Age Friendly Lakeland, is working on to meet some of these goals?
So currently we have several committees going at this time, subcommittees rather, that really address those goals head on. And one that I'll start to tell you a little bit about is our CNA Career Path Initiative. And this initiative basically came from the feedback of the community that especially after and during COVID, there were not enough caregivers in the community to keep family at home, or there were many positions open that businesses, local businesses, needed the positions filled. And so subcommittee came together, and maybe by hoping to show a career path to start in a CNA position, we could show that bring more people to the job. And AFL wanted to basically remove the financial barrier for folks to be able to get a CNA certificate so they can start in a position, make a good wage, and hopefully advance their career from there if they had any interest in nursing. And I will say successfully, we've sent through 11 candidates, some great success stories out of these folks, and we are still looking for more candidates to go through and scholarship through. Another subcommittee that we have is our Age Friendly Lakeland Business Seal. This one is still in the initial phase. We're still surveying to get more information from businesses, how we can support them. But overall, the idea of this committee is to bring awareness on how businesses right here in Lakeland could make themselves more age friendly. So that being physical, that being training employees for how to treat older adults, being aware, customer service, charging the wheelchair and assistive devices, giving knowledge about bigger spaces in the washroom, many different things that we could basically support businesses and get feedback to make our community really more age friendly. We also, right now, are working with the neighborhoods. We're doing a massive neighborhood outreach. It's a big collaboration with lots of businesses. It's the Vial of Life. And in this Vial of Life, we're trying to get this out to all of the neighborhoods. More specifically, right now, we're focused on ones with older adults. But the idea behind this is to basically keep a medical record of all of your important information, and we're working with first responders in Lakeland and Greater Polk County to look for the sticker, for the Vial of Life sticker on the freezer door, to look there first for information that maybe somebody close to you doesn't have. They could just go right to the freezer and all the information would be right on the forms. So we are actively distributing these out with the Sage Aging Elder Care Guide partnership, which has been a huge help so far in the community. And our last committee that we have would be our Senior Center Initiative. So I'll let Liz tell you a little bit more about that.
Sure. We're super excited about that. And at this stage, it's really a needs assessment. We have brought together a committee, a very broad cross-section of people who serve older adults, not just in Lakeland, but all across Polk County, to find out what their thoughts are and what they're seeing as the possible need for a senior center in our community. We are honestly one of the only communities of our size that doesn't have one. So it's important that we really look at this closely. The community at large is highly in favor of this. As a matter of fact, one of the Lakeland Vision surveys that we sent out asked people what their most important piece was to living a quality life in this community, and the very top response was the relationships. You know, having really good, solid relationships. And where do you accomplish that? Not in your home by yourself. We need a place for people to gather, and we need a place for people to access information. So we are working on doing some visioning in Lakeland Vision fashion, and really just talking to people about what they see as the needs. And that is something you'll want to, pay attention down the road. We'll have more information about that. But right now we're in the needs assessment stage and hope to bring back some more information to the table by the end of the year.
Since we are a large community and people live in different sections of the community, how are you addressing that?
Well, we don't have a clear vision as yet. However, one idea that we are talking about seriously is a hub and spoke model, which would create one center as a hub, or kind of a home base, if you will, and then the spokes being locations that are all throughout the community, maybe in neighborhood clubhouses. Maybe Kelly Rec is one of those hubs. The Rath Senior Connection Center, they're at College Heights United Methodist Church, and maybe that's one of the hubs. The idea is to connect people with all of the wonderful things that are already happening in our community, but to have one central location where if you don't know where to go, you go to that one space that the entire community is plugged into, and we can get people the assistance they need, the activities they want, and the connection with others that they crave.
Are you also looking at transportation to these centers?
That's something we haven't really addressed within that committee yet. We're still in the needs assessment phase of a senior center, but that will be an extremely important piece. That is a conversation that we've been having for as long as I can remember in this community. It's a very difficult piece because we don't want people who shouldn't be driving getting behind the wheel. But unfortunately, because transportation is such an issue here in our community, and there is not really an accessible mode of transportation for all older adults, we find that a lot of people are driving much longer than they should. And that causes a lot of problems on the roadways. But, that's a conversation for another day, I think.
Conversation. Thank you. If any of our listeners are interested in this work and would like to be a part of Age Friendly Lakeland, what is the best way for them to plug in?
I'll let you take that, Allie.
I would say the best way to plug in, if you're looking to be a part of the committee and get involved, to definitely reach out and contact us. You could email me. It's Allie, ALLIE, at agefriendlylakeland.com. You could visit our website. There's lots of information on there. And follow us on social media. We have lots of updates that go out that are very vital to the community. We also plug in with Lakeland Vision. We share their monthly surveys that go out. Oftentimes we run our own surveys also, and we are always looking for that feedback for how to get, basically what it is what you want in the community. We really try our best to try to have that, bring that information forward.
And as the website again?
The website is www.agefriendlylakeland.com.
And if I'm not on social media?
If you're not on social media and you'd like to get involved, we do post when we have our committee meetings in person. They're quarterly currently. They are posted on the Lakeland Vision website as well.
Any final thoughts or information you'd like to share?
I'll just piggyback on what Allie was saying about surveys. If you're listening to this, then you probably know there will be a survey that follows. It's super quick, less than a minute to complete. So please go ahead and complete that, because Lakeland Vision and Age Friendly Lakeland, we really pattern what we're doing by the feedback we get from the community. And if you feel like your voice isn't being heard, just raise your hand. We want to hear you. We want to talk to you. We want you involved in our committees, and we want your participation. Everyone is welcome. The door is open. So reach out to us and let us know. We'd love to hear more from you.
So suppose I just moved to Lakeland and I retired and I came down here and moved into one of the, I didn't move into a retirement community. I moved into a home because I have some relatives nearby. How would I go about finding what resources there are in the community? Where would I even start? I could start by calling the phone number. Again, Allie, what is that phone number?
That phone number is 863-333-5129.
Thank you. Liz, how do I do it?
That's a great question. And let's kind of talk from the perspective that there are a lot of different people who use different modes of communication. So the phone number is super important. There are still people who are going to venture online, but we're kind of half and half right now with the older demographic doing that. So it is vitally important that we have information that is easily accessible and easy to use for them. So if somebody's online and we send them to something that's digital, then that might be a little intimidating for them to use. And so we are very fortunate in this community to have a lot of resources that they can hold in their hand. And Sage Aging Elder Care Guide is one of those. I'm super proud of Sage Aging Elder Care Guide because that's something that my husband and I have been publishing for 29 years now. And that came from a personal family situation. My husband's grandmother, she had Alzheimer's. And when she fell and went to the hospital and needed to be referred to a nursing home, the hospital gave us a sheet of paper that had phone numbers on it and told us to make phone calls. And that was the resource that we had to try to guide ourselves through that situation. Now, that was more than 30 years ago, and Google didn't exist, and we just did the best we could. We started asking people in our community, and we started asking at church. We went to the library resource desk. We asked people who worked in nursing homes or who had older loved ones that they had been caring for. And through that experience, we recognized quickly that other people needed the same kind of information. And so for 29 years here in Polk County, we have had a handheld guide, something that is still in print, and we don't plan to get rid of the print anytime soon. It is available online for those who are more comfortable with that. And frankly, a lot of children live out of state while their parents live here. So here locally at hundreds of locations around the county, you can find them in waiting rooms. You can find them in medical waiting rooms. A lot of social workers hand them out. A lot of folks who serve the older adults in our community also have them in their possession. Another great place to start is the Senior Connection Center. Whenever in doubt, no matter where you are in the United States, the first thing you look for is your area agency on aging. For us in Polk County, that's the Senior Connection Center. And so they're going to call 1-800-96-ELDER, and they will be connected to a referral specialist who can help walk them through what might be available to them. Chances are they're probably going to send them a copy of Elder Care Guide if they live in Polk County, because that is the most comprehensive resource that we have here in the county for services related to older adults. So, but beyond that, I think the best thing to remember if you are looking for resources is to look around you. Use the relationships that you have and ask questions. Don't be afraid to speak up. And I think many times we suffer through things on our own, thinking that we're just going to try to solve it and try to fix it and try to find our way, when we could have a much easier path if we just speak up and say, hey, Pastor, I'm really struggling with this, that, or the other, or my spouse is having some cognitive decline. I don't know what to do and where to connect. Chances are, if you ask somebody in your sphere of influence, in your circle of friends, in your neighborhood, you're going to find somebody that has been through it already. And that is the most powerful place that you can first look for help. But there are a lot of resources here in the community to take advantage of, moving beyond the general resources like, assisted living communities, home care agencies, nursing homes, hospice. All of that is contained in that guide. But for those who are in the active phase of their older years, where they want to find out where to play pickleball, or maybe they're looking for a concert, or they're interested in something happening with art and culture, well, they can go to eldercareguide.com/events. There's an events tab there right on the homepage, and they can look and see what's happening in the community. Now, that's not a handheld piece, but those who are most active are most likely online. I would say contact the city If you're looking for things to do, there are a lot of fitness activities and a lot of activities that are happening in the neighborhood centers like Cali Rec and Simpson Park that you can participate in. So much fun. Everything from pickleball and ballroom dancing to crocheting and group meetings. And there are support groups all over our community. So whatever you're looking for, it's there. If you can't find it, call that number that Allie gave out before. You can also call Sage Aging Elder Care Guide. That number is 863-802-5043. We're always happy to handhold families through that and directly connect them to the people that can be of most help to them.
So if I want to call the city, do I just call the main city number and they'll connect me
Yes.
to whoever?
Yes. Or you can, if you look wherever you find your number. Is 411 still a thing? But if you were going to call Cali Rec, they do have a direct number. I don't know Cali Rec's direct number off the top of my head. Simpson Park, the libraries are just packed with really cool events and a lot of fun things happening. The Polk Museum of Art, among many others. There are so many great things happening in our community. So I would say if you know geographically that you want to be in a certain place, call that place directly. Otherwise, if you call the city's direct number, they can connect you.
Thank you very much.
And I'm actually going to jump in for the first time ever since I work for the city and tell you the city's direct number, which is 863-834-6000. And you can also go to lakelandgov.net/events.
Yes.
Thank you very much, Andrew. Is there anything else we've forgotten to mention?
Actually, one final thing I'd like to mention is the Sage Aging podcast. This is a locally produced podcast by myself, and it is all about the topics that you face as a caregiver. If you are a caregiver and you've got aging loved ones at home, whether you're caring from here locally or you're caring for someone who is far from you, these are conversations that you need to be a part of. We do our best to cover everything from self-care of the caregiver to practical things like how to get the most out of your next doctor's appointment. It's really easy to find. You can find it on YouTube. You can find it, and I know not everyone is online, but online right now is really the only place that you're going to find it. But you can find it via our website, one click. You can find it on YouTube, search Sage Aging, and you can find it via any podcast app by simply searching Sage Aging. We're super proud of it, and there is a lot of great information from a lot of professional guests that we have on the show. Every other week we've got a new episode, and you can get on the mailing list for that at eldercareguide.com. Just sign up for our newsletter.
Thank you. Allie?
And before we go, I would just like to congratulate Liz again. Last week, Liz was recognized by our peers all over Polk County, and she received the Legacy Award from our Better Living for Seniors of Polk County Coalition. And Liz has just brought together so many people to bring the focus back to our older adults in our community and connecting. And so, Liz, congratulations for receiving that award.
Thank you so much. That was such an honor. I'm a person who does, and I'm happy to do. That is my paycheck from everything that I do, that I lay down at night and I feel really good about the legacy that I'm leaving behind in my community by the work that I do. And to be honored was a little bit uncomfortable because I'm used to heaping praise on others. However, I am so grateful, and there is no better feeling than standing in front of a room of people that you respect so much for all that they pour into the community and all that they do for people. For them to turn around and shine a spotlight on me was very humbling, and I'm very thankful and grateful. So
congratulations.
Thank you.
Thank you, Liz and Allie, for both coming to join me today, and all the hard work you and your volunteers invest into our community through Age Friendly Lakeland. Thank you for tuning in to Listen Lakeland. Your feedback is valued, and we encourage you to head over to www.lakelandvision.org to participate in our monthly survey related to today's show topic.
I said, welcome to the good life.
Listen Lakeland is brought to you as a collaborative project between Lakeland Vision, the City of Lakeland, and Hall Communications, a community working together to provide an exceptional quality of life. Thank you for being with us.